Our program is for NCAA Female Division I volleyball athletes. Our objectives are to train female NCAA Division I volleyball athletes. The goal for these athletes is to improve on their strength, power, core and balance, and energy development system needs. Volleyball consists of accelerating, decelerating, jumping, change of directions, cutting, and lateral movement activities in multi-directional planes. Volleyball is characterized by acceleration and deceleration and change of direction. Specific movements include jumping, blocking, and hitting. Physiological demands require ATP, PCR, glycolytic, and aerobic energy system utilization. Volleyball athletes primarily use ATP PCR. However, the average play lasts 6 seconds, but it becomes glycolytic when they only have 14 seconds of recovery. The aerobic system is used over the course of sets with limited rest time in between rallies. Injuries include both lower and upper body extremity injuries. For female volleyball players, lower body injuries are usually most common. Volleyball players demand access to all three energy systems while also having to focus on concepts such as eccentrically loading while managing strength and agility to optimally perform in multiple planes. Volleyball athletes are prone to lower body and upper body injuries ranging from minor sprains and strains to tears and breaks. Most injuries that occur during volleyball are non-contact. Increased risk factors for non-contact injuries include repetitive hitting, jumping, landing, and blocking. Ankle sprains are the most common acute injury in volleyball. Varied multi-directional movements evoke high stress demands on athletes' neuromuscular, skeletal, and connective tissues. This places volleyball athletes at an increased risk for both acute and chronic injuries. Reitmeyer and Eric Hans reported 49.28% of volleyball injuries are lower extremity and 50.22% are upper extremity in one study. Lower extremity injuries consisted of 31.9% ankle sprain rates and 17.38% knee and joint injury rates. Bracing and taping is one solution for ankle injury sprains, but is only recommended after multiple injuries due to the instability after suffering the initial injury. Upper body injuries consisted of 13.44% for fingers, 12.38% for low back, and 12.18% for shoulder trauma. Male volleyball players were recorded for an injury rate of 12.4% per 10,000 athletic exposure hours, while NCAA women's volleyball players had injury rates of 40.6 per 10,000 athletic exposure hours. The two most common injuries for the lower extremity besides an ankle sprain is an ACL tear at 13.7% and patellar tendonitis at 25.1%. ACL injuries account for 17% of the non-contact injuries in the overall female athlete population. Increased risk factors include difficulty loading their posterior chain, coupled with muscle imbalances that contribute to knee valgus, placing more stress on the ACL ligament. Instability was seen for up to 2.5 years after surgery, which makes rehabilitation on stabilizing while landing an important factor. Patellar tendonitis represents the most common overuse injury in volleyball. Referred to as jumper's knee, 19.3% of NCAA female athletes suffer from it. This injury is characterized as an inflammation of the patellar tendon and has been alternatively reported that an estimated of 40 to 50% of elite volleyball players have jumper's knee. Common factors include tight leg muscles, uneven leg muscle strength, misalignment in the feet, knees, hips, and ankles, hard playing surfaces, chronic diseases that can weaken the tendon, and finally, the shoes without enough padding. Volleyball athletes are more susceptible to this condition due to the great amount of force placed on the joints with landing. Shoulder injuries were the third most common type of injury for volleyball athletes. Rotator cuff tendonitis accounted for the majority of the shoulder injury with 53.3% of NCAA athletes. Volleyball incorporates both lower and upper extremity movements, which leads to an increased risk of both lower and upper extremity injury. Symptoms of rotator cuff tendonitis include swelling, pain in the front of the shoulder or side of the arm, loss of mobility, clicking sounds triggered by raising and lowering the arm, in addition to pain reaching behind your back. Volleyball players are more susceptible to this condition due to the high volume of swinging, hitting motions paired with lack of rest. These issues can become chronic over time. Field testing in volleyball is used to measure agility and acceleration. By incorporating field testing, we are able to prepare the athlete by simulating some of the demands for competition. For this, we'll be using the Arrowhead Agility Test. We will be working on force and power development using a counter movement test. For aerobic endurance, we'll be using the Yo-Yo Intermittent Recovery Test to improve VO2 max and prepare the body for aerobic demands of sport. Finally, we will be working on anaerobic endurance with repeated sprint tests of 5 by 30 meters with 25 seconds of recovery. The Arrowhead Agility Test examines speed, explosive power, and rapid changes of direction while sprinting. The counter movement jump test has practical application for volleyball players by measuring power and can be regularly tested during all parts of the season. Counter movement jump testing is used to evaluate the force velocity capabilities of volleyball players. Martinez et al. Found these tests to have highly established validity, reliability, and specificity towards volleyball performance. The Yo-Yo Intermittent Recovery Test was used for aerobic training and was validated by Perkis et al. And can be seen in our figure 2. Perkis et al. Found great improvements in physical capacity after only 4 weeks of additional speed endurance training. This suggests volleyball players and coaches should aim to intensify their training with the inclusion of high-intensity training. This type of training can be applied in the collegiate setting by leading up to conference matches and/or the NCAA tournament. We also focus on weight room testing for volleyball athletes, and we include 1-rep max testing in the back, squat, deadlift, and bench press. Since these are NCAA Division I athletes, they have a higher, more demanding training age and are able to handle the 1-rep max resistance training test compared to the average female volleyball athlete. Having an updated 1-rep max in these lifts helps adjust programming to maximize results. By using this test, we're able to measure and track progress through the max strength, basic power, and max power mesocycles. Once the 1-rep max is calculated, it can be used to vary the intensity of the exercise and be tapered to meet the individual goals of the mesocycles listed above, as well as the athletes. Core and balance training are essential aspects for all athletes. Berker-Doe et al. States balance is control and control is crucial in sports, an important component of motor skills. The importance of balance and prevention of injury emphasizes sport performance. Having good force-couple relationships helps in creating force and power needed to perform while reducing risk of injury and allowing biomechanics of joints to move correctly. The importance of balance and prevention in injury emphasizes sport performance. Instability and weakness in an athlete's core can lead to increased risk of injury in sport during athletic performance. When the core is not strong enough, this leads to bad force-couple relationships when muscles are either too tight or too loose and have decreased ability to generate force. Balance training can be specific and varied in different skill sets and improved through repetition in all planes of motion. Balance training uses vision, the vestibular system, and proprioception information to improve balance through neural programming. Unstable equipment trains both proprioception and the vestibular system. Postural control and static balance are enhanced by performing these types of training exercises. Combining core and balance increases efficiency when transferring force from lower body to the upper body. Having a strong core and lumbopelvic hip complex provides stabilization, which improves the basis of support for lower extremity function. Female athletes are prone to ACL injuries due to the instability and inability to load their posterior chain. Tests done on high-level athletes show signs that they may have unstable core, which can lead to musculoskeletal injuries. Dynamic core and trunk stability are required to land correctly. It is important that volleyball athletes are able to land and stabilize quickly when performing plyometric and sport-specific movements. Being able to stabilize and transfer force during volleyball is directly applicable to the demands of the sport. Volleyball is considered a power sport. However, it consists of mostly aerobic energy systems because of the minimal rest time, which is why it's important to build the aerobic energy system development so that it can be transferable to competition. Work to rest ratios of 1 to 10 to 12 focuses on ATP PCR, while ratios of 1 to 1 or 1 to 3 stresses aerobic systems. It is important to increase a volleyball player's VO2 max due to the qualities of intermittent play in volleyball. During the anatomical adaptation phase, we will focus on long, slow distance and full body training circuit to prepare the body for the muscular endurance mesocycle. For our muscular endurance, we will continue full body circuits and begin incorporating longer interval training to elicit adaptations to improve VO2 max. Leader et al. Supports this by showing an increase in volleyball athletes' VO2 max when trained aerobically. These findings demonstrate the importance of training in the aerobic zone because their lactate threshold increase, leading to higher performance in competition. For our max strength mesocycle, we will be working on repeated sprints, working on a ratio of 1 to 8, while working to stress the ATP, PCR, and glycolytic systems. In our final max power phase, we will be focusing on sport-specific exercises that are able to prepare the athlete for competition and work our rest to work ratios of 1 to 10 to 12. Speed, agility, and quickness are extremely important and transferable to the sport of volleyball. They're used in every forward, backward, and lateral maneuver performed by volleyball players. Quick movements are important because volleyball is reaction-based, requiring quick reactions to open stimulants. Improving in agility allows athletes to transition quickly in a short period of time. The program will begin in the basic strength phase with predetermined cuts, focusing on technique and preparation for change of direction. Accelerating and decelerating and multiplayer movements for sports-specific demands. We are focusing on predetermined cuts to build up the strength in the planes of motion before progressing to an open cut. Exercises will include predetermined cuts at 45 and 90 degrees, respectively. For acceleration and deceleration, we are focusing on movements in a split stance due to the number of movements performed in the stance for volleyball. We've progressed these exercises by adding partner resistance and multiplanar movements. For the development of basic strength, we are focusing on cutting, which focuses on a quick, sharp movement, change of direction where the focus is changing directional momentum as quickly as possible. The max strength phase focuses on acceleration and deceleration, and the final focus for our max power, we will be doing get up and falling starts paired with light resistance partner banded sprints at 10%. Plyometric training requires the use of the stretch shortening cycle in order for the neuromuscular system to produce force in the quickest amount of time. It is important to stretch the neuromuscular system in order to develop anatomical adaptations. This is done through neuromuscular training. While working with Division I athletes, the focus will be less important on technique than the average female due to the higher training age and competition level. However, it is important to focus on proper technique when performing these exercises. It is important to stress proper technique in the eccentric phase when landing in order to reduce risk of injury. Plyometric training increases in intensity with the number of foot contacts and not the amount of repetitions. Plyometric training will progress from double leg movements to single leg movements while progressing through the plyometric program. For basic power, we will be focusing on rep ranges of 6 and below at 80% on power movements and 85% on back squat and deadlift, 70% on accessory lifts with work to rest ratios of 1 to 3. We will also have a less than 150 foot in hand contacts for plyometric. Max strength will be focusing on rep ranges of 4 to 8 at 80 to 85% on heavy days and 75% on light days with work to rest ratios of 1 to 2 to 3. Building on unilateral movements in order to improve strength and decrease bilateral deficit and improving bilateral enhancement is important. For max power, our rep ranges will be 1 to 6 on a heavy day and 80% depending on the lift.